Hi, we are glad to welcome you in this course, Bridging Healthcare and Society. In this video, we will tell you why this course was organized and what kinds of problems we will study together with you during the following weeks.
The rise of modern medicine began in the middle of the 19th century. This was related to understanding the connection between diseases located in human body and particular causes of these diseases. First of all, this meant understanding the role that microorganisms play in the development of illnesses. For example, relation between the tuberculobacillus and tuberculosis, between the Vibrio cholera and cholera. With these developments, medicine decisively took the scientific direction. Nowadays, medical science, together with healthcare, significantly impact people's lives on different levels, from healing ordinary flu to applying artificial reproductive technologies. In order to highlight the transformative potential of modern scientific medicine, medical anthropologist and emergency physician Wim Kien Nguyen has even suggested that biomedicine is to the 21st century what the Industrial Revolution was to the 19th.
Scientification of medicine contributes to its professionalization. It resulted in an increasing number of laboratories, medical education programs, and hospitals where medical knowledge is produced, taught, and applied. The reformed medical profession has come to be characterized by a very particular body of knowledge. This knowledge determines specific medical standards and makes medicine relatively free from control by non-medical professionals. On the one hand, sociologists like Talcott Parsons stress social functions of medical doctors, as they not just cure their patients, but they're entitled to label them as ill or handicapped. On the other hand, social scientists like Andrew Abbott describe how medical authority itself is conditioned by social processes. It means that the medical authority has been gained by doctors through cooperations and negotiations with the state and the wider public.
Rapid development of medicine resulted in medicalization that led to wide implementation of mostly curative approach in treatment. Within this approach, the process of treatment focuses on the disease and possibilities of doctors to fix it, as some kind of mechanical problem using advancements in diagnostic and treatment tools. This provokes miscommunication between patients with their particular needs and healthcare professionals with their vision on how the process of providing healthcare should look like. As a result, level of satisfaction among healthcare consumers is low, as well as lack of trust to medical field among majority of the population.
So, this course aims to provide insight in the interactions between medicine, healthcare, and society, using the analytical angle of professionalization and scientification of medicine. Through the lens of these concepts, we will study cases and situations of disjunctures or gaps between healthcare and society, and reflect on the ways to move forward in bridging these disjunctures.